Assalamu alaikum. My name is Arhum Javed Malik and I have done my post-graduation from Noor International University, and the topic of my research is impact of ketogenic diet on the health status of adults. These are the highlights that I will be following throughout this presentation. Introduction, introducing ketogenic diet in front of you, objectives of my research, methodology, how this research was planned, results and discussion, what was the result of this research, and comparing them with the previous researches, concluding my research, and then references. Talking about ketogenic diet, keto diet is a high-fat, medium-protein, and low-carb diet. It consists of 80% fat, 15% protein, and 5% carbs. Initially, this diet was actually introduced to help in children in the 1920s with epileptic seizures. Additionally, this diet actually shows in the treatment of various diseases that are hormonal imbalances, PCOS, diabetes, UTI. In the year 2020, this diet was the most searched diet globally. It was predicted that by 2027, 15.6 billion people will be following this diet. The leading countries with the most ketogenic followers are USA and Canada. Objectives. The main objectives of the study were as follows: to develop a questionnaire to assess the health impact of ketogenic diet on adults, to determine the reliability of questionnaire on Bronsback mark scale, to observe the impact of keto diet on the overall health status of adults, to explore the correlation of ketogenic diet and health outcomes, to assess the differences in health status of individuals following ketogenic diet for various duration. Hypothesis. The hypothesis of this study were: hypothesis number 1, ketogenic diet will likely to have significantly negative relationship with health. Hypothesis number 2, adults following 4 months of keto will likely to have greater health. Methodology. Study location, various institutes like gym, hospitals, and universities. Study design was quantitative method. Study duration was 3 months. Selection of keto followers included males and females of 20 to 40 years of age who were following keto diet for 2 months or more, excluding the people who were following no diet or other diet, or people having any disease or any other alignment or taking medication. Questionnaires were given to be filled, and final data was collected. Results. The sample size for this research was 80, and the age was 20 to 40 years, which had a mean age of 30.50. Mean previous weight of the participants was 88.46, and mean current weight of the participants was 71.57. And this shows that the ketogenic diet had an impact on the weight. Psychometric properties of health and ketogenic diet scale. A reliability of a scale portrays how effective a scale is. This is known as Bronsback alpha, the measure of internal consistency, that is how closely are the items related in a group. I had developed my questionnaire myself, so I had to determine its reliability. I had divided my scale into 2 groups: health and ketogenic diet. Health had 14 items, which had a Bronsback alpha of 0.70, which is considered reliable. Ketogenic diet had 10 items and had a Bronsback alpha of 0.50, which is also considered reliable. Intercorrelation for ketogenic diet and health status in adults. When we are checking the relationship between 2 variables, we perform the Pearson product movement correlation. It showed that significant negative relationship between ketogenic diet and health, which is actually proving my first hypothesis that there will be a significantly negative relationship between ketogenic diet and health. Mean differences in months on ketogenic diet and health. One way ANOVA is actually applied when we are checking the differences between variables of groups. Adults following 6 months of ketogenic diet have greater differences than 2, 4, 5, and 5 months of following keto. So this means that 6 months have a greater difference than 2, 4, 5 months, which is and so if you remember my second hypothesis, that was that 4 months will have a greater impact on health. But this result is actually rejecting my second hypothesis. These researchers actually stated that weight loss can be distinguished, but it can raise various side effects for long-term periods. As the body's mechanism is shifted to fats, the body's source of energy is eliminated. As carbs are the sources of your energy, and you are not taking that much carbs to give yourself energy, and you are just gaining energy from fat. The level of urination rises, and the body becomes sustainable to suffer from dehydration. Meanwhile, the body shifts to ketosis, showing the symptoms of keto flu. Keto flu is actually like a normal flu, but you can feel nausea, dizziness, a simple flu, fever with this keto flu. As far as the negative impact of keto diet is concerned, it has been shown that the keto diet causes kidney stones and micronutrient deficiencies, thus affecting human health. Micronutrient deficiencies can be caused as you are not taking fruit, you are not taking the basic nutrients that would give you these vitamins and minerals. So basically, your body is being deficient of these nutrients. This researcher reviewed that difference in the duration of the keto diet following. In their study, they targeted athletes following this diet from 21 days. Their data showed difference in the endurance strength as the duration increased, whereas the data in this research was from 2 months till 6 months and revealed 6 months with greater differences. The longer the duration, the advanced the difference will be on the health. Conclusion. My study concluded that that the correlation design actually proved that there was a negative relationship between health and adults. Sorry. One way ANOVA revealed that 6 months had the greater difference than 2 months, 4 months, and 5 months. Multiple people followed this diet on their own. There is a limited number of carbs, so people are tending to eat less than they are craving for. It is advised that this diet be followed under the supervision of a nutritionist. The people should get medical checkups before following this diet. These are my references.